Before we get started, we thought it would be wonderful to start with a prayer, and I asked Deacon Jerry if he would please do an opening prayer for us. Thank you.
Hi. Good afternoon. Is this the new employee orientation? Is that what this is? Oh, okay. No, I think I have the wrong group. No, thank you. Just as I'm sure we all discerned our vocations and our career paths, and maybe when we prayed for which college we would choose to go to, I think it's always important that we should also discern our path into retirement and through retirement, because that's really the next great crossroads of our lives. So, let us pray to the Lord for guidance to know when we should retire and to know how we'll spend our time in retirement, how we'll be productive and joyful and be able to continue to spread the Lord's word to those who need his love. So before we begin this session, let us just take a moment to quiet ourselves and bring our minds and hearts into awareness of God's presence with us. So let us pray. Heavenly Father, we come before you asking for wisdom and guidance as we contemplate a new chapter in our lives as retirees. We don't know what the future holds, but we do trust in you. We know that you have good plans for us. Help us to come to know those plans and help us to cope well with the changes to come in our lives. Help us to make the best decisions on when is the right time to retire. And let your wisdom guide us on how to manage our retirement benefits. And we ask all this through our Lord Jesus Christ, your Son, who lives and reigns with you in the Holy Spirit, God forever and ever. Amen. And the Father, Son, and Holy Spirit. Amen. Thank you.
Thank you, Father. Deacon, I'm sorry. Give you a promotion. Okay, so I'm just going to review the agenda and a little bit of housekeeping as well. We are very fortunate enough to be able to rely on some of our partners who are subject matter experts in areas that we'll be delivering today. So we're going to hear, as I said, on Medicare, on Social Security, on retirement, savings and investments, and even on our own healthcare plan with regard to what you have available to you now, and just to be sure that you're aware of what occurs upon retirement. We really would like to do a Q&A as well, if time permits. So on each of the tables are blank cards, and as you think of a question throughout the presentation, write it down on there, or if you have a question that maybe we'll cover, maybe we won't, write it down. Candy and Joanne, where's Joanne? Yeah, there she is. If you just hold it up like this, they're going to collect it, and then at the end of the presentation, the panelists, the speakers will join me on a panel, and we'll get through as many as we can. We will do a written Q&A if we can't get to everything, and we'll distribute to everybody that's here as well. Of course, timing could not be more perfect because there is a retreat going on today for all of our pastoral associates, many of which wanted to be here. And we're very fortunate that our communications team in Mike and John have stepped up to the plate and are professionally recording this. So it will be available for you if you wanted to review it again, and or to any of your colleagues who were not able to make it today. It's very important that I give the time to our presenters to speak. So just so you know, we're going to hear from Stephen Porto, who is the Area Vice President of the Gallagher Insurance Group, which is our partner that helps us to administer the healthcare benefits to everyone throughout the diocese, schools, parishes, and our offices here. So not to make it easy on me, of course, we are doing a remote Teams meeting with Stephen. I believe he's in New England. Is that where he resides? Albany. Okay. So I think we're pretty set for that to go seamlessly. But that will be our first speaker, and then we will hand it over to Chip and Brian Fowler from the Fowler Group, and they will talk about our 403B plan, our 401A plan, etc. And then we have Kathy Pasatino, who is the area senior vice president with Gallagher, and is our main point of contact with our health insurance, and she will also speak about that as well as some Social Security tidbits and things of that nature. And then as I said earlier, a Q&A, and we hope to get everybody out of here within an hour and a half. And then we're going to be doing the same presentation at one of the high schools at 4 p.m. So if you see us bolting, that's why. It's at Paul VI, and I'm told it only takes about 20 minutes to get there. But that's where this concept originated. They've been doing this program or a similar program for years. And when I came in November of 20, it was COVID, but everyone kept saying, when are we going to do the retirement seminar again? There's so many people that found it invaluable. And no, they didn't rush to retire, but they really wanted to hear this important information again. So as we were planning it and drawing on all of these resources, we said, why don't we try and offer it here to the Chancery campuses and everybody else? And we thought maybe we'd get like 6 people, and we have nearly 50 here. So obviously this is very important and timely. So we're glad that we were able to offer it. Just so I don't forget at the end, I want to thank my team, which Candy Newhouse, who is embedded with us here from the Gallagher Group as well. She was my primary partner on this. And then I have Joanne, who without her nimble copying, we would not have any materials. So thank you. And Pat is really the person that handles so much with regard to your pension inquiries and applications and things like that. So she is also, as part of this, she will also be someone we may point some of the questions to that you have. So without further ado, we are going to kick it off to Steve, who will be on the big screen with his presentation.
Welcome everyone to the Medicare seminar today. I appreciate you coming, and I hope that this is extremely educational for you. My name is Steve Porto, and I am the licensed Medicare professional for Gallagher, who is the insurance broker for the diocese. So I'm here as a resource available to you. There's no cost associated with it, and if this presentation does not answer your questions, feel free to reach out to me. You'll be provided with my number, email. You can reach out to me with your personal questions, and I look forward to working with everyone. I also think that there'll be some time at the end of the seminars today for questions, so I look forward to that as well. Now, one quick note before we get started with the seminar. This is going to be a really high-level type presentation for Medicare. Given the time constraint, we could talk about Medicare for probably 2 hours straight. This is going to be hitting all the high notes, really, just quick high-level education. So again, feel free to reach out to me with your own personal questions. But I do think that this will be a good, 20, 25 minutes to educate you and feel like you at least can get started with the Medicare discussion. So today's agenda, we're going to be talking about a quick review of the Medicare basics, avoiding late enrollment penalties, coverage choices and considerations while employed, and then we'll go over some useful resources that we have available to you. Jumping right in on the review of Medicare basics, I'm sure this will be, I'm sure that this will be a review for many of you, but it's going to go quick and it's always good to rediscuss. What is Medicare? Medicare is a federal government-sponsored health insurance program, and it's administered by CMS, that's Centers for Medicare and Medicaid Services, and enrollment is managed through Social Security Administration. So Social Security is the government entity that you would really have all of your interaction with, and they're actually really the first level, the first step in the Medicare process. So Social Security, that's going to be a common name for you coming up as you transition into retirement. Who's eligible for Medicare? Folks that are age 65 and older, and folks with certain disabilities under age 65. The parts of Medicare, Medicare is extremely complex, but I always say if you just narrow it down to the A, B, C, and Ds of Medicare, it really can feel much more simplified. So we're going to go through each part of Medicare here. We're going to talk about it. Our resources really expand on this, but for the presentation, this is really going to be an open forum discussion, and then use the resources to educate yourselves here after the meeting. So we start with Part A and Part B. This is what's called Original Medicare. Original Medicare is what's controlled by the government, all right, Social Security Administration. Now, Part A covers hospitalization, and Part B covers medical, outpatient type services, doctors, surgeries, lab work, things like that, your everyday medical. Again, together it's called Original Medicare, and it's really controlled through Social Security Administration. Now, Part A and Part B do not cover everything that the everyday individual needs. So what happens is folks go on to supplement and add on to Part A and Part B. Once they retire or need coverage, they add on with either a Part C with Part D or a Medicare supplement. Now, you can't do both. It's one or the other, right? So once you are adding on to your Part A and Part B, you're choosing one path or the other. It's either the path of Medicare Advantage, which most of the time will include Part D prescription also, or it's the path of a Medicare supplement, which is also interchangeable with the word Medigap. So with Part C plans, the concept behind these is that a Part C Medicare Advantage plan is sold by a private carrier, right? United Healthcare, Humana, Cigna, Aetna, those are the really big brands that you'll hear about. I'm sure you all get a lot of mail to your mailboxes, commercials on the television, Joe Namath hollering at you. These are mostly Medicare Advantage advertisements. It's all over. And it's sold by private carriers. You have a network of doctors to use. And what the coverage is that it has to cover at least as much as Part A and Part B with Original Medicare. But oftentimes it will add on to that coverage and also cover extra items like dental, vision, hearing, prescription Part D. A lot of times they throw in extras like transportation services, free gym memberships through Silver Sneakers. So it's really an all-in-one type purchase. And it's about 40% of the population in America chooses these plans. 60% are still choosing the other route, right? Medicare supplements or Medigaps. Medigaps are also sold by private companies, many of the same name. These are standardized government plans, though. So these are the letter plans. You'll hear F, N, G, Supplement Plan C, Supplement Plan B. They're standardized, so all of the plans cover the same exact thing, but the premium and underwriting requirements could be different with each carrier, right? So the big selling part of a Medicare supplement is that, number one, it's an open doctor-provider network. So you don't have the provider network constraints that a Medicare Advantage plan would have. You can really go anywhere you want as long as that provider accepts traditional Medicare. So that's a big check mark in the Medicare supplement column. Some other features about Medicare supplements that differentiate it from Part C plans is that it's strictly medical coverage only. So even if you buy a supplement plan, you still have to purchase a Part D prescription plan. And if you want dental, vision, those are also extra plans. So it's strictly medical coverage, open doctor network. Now, a couple of the negatives, it's going to be higher cost than Medicare Advantage plans. Medicare Advantage Part C plans, a lot of them are $0, low premium type options. Medicare supplements, you're going to pay more. Average client, probably in the $150 to $200 range for these plans. So it's a little bit more expensive, but you also get maybe a little bit more Cadillac type coverage with the Medicare supplement. And we're going to talk more about this as the presentation moves on. So what is the premium cost for Medicare? On the left-hand side, you see Part A is usually no cost. It's usually free as long as you've paid in with your Medicare taxes. And Part B now does have an income premium associated with it. And the table is to the right there. Now this table is pulled straight from the government Medicare site, medicare.gov, and it is income-based. So a few points here. Number one, they're looking 2 years back at your adjusted gross income. So right now they're looking at your income filing from the year 2020. So let's take this first example here. First row, if you're a joint tax filer and you made less than $182,000 in 2020, you're going to pay that first tier, $170.10 a month, right to the government, billed to Social Security. If you're taking Social Security payments, they take it right out of your check. If you're not, they bill you on a quarterly basis. Now you'll see that that goes up. So if your income goes up, it goes up pretty drastically. And if you're an individual tax return filer, the incomes are, a little bit more constraining. They go up a little bit faster based on income. So that's your first cost to understand in the Medicare system. If and when you're moving to Medicare, your Part B does have a premium, and this is the grid associated with that premium. Now the last bullet point on the left, Part C, D, and supplement plans, premiums for these are billed through the private carrier, and it's billed on a monthly basis typically, and they vary. They vary from $0 to a few $100s, all depending on the plan you choose. This is a point in the presentation where I usually point out the fact that this presentation is educational based. Okay, so what we're not going to get into today is actual plans, prices, and benefits for you. That's not compliant in a group setting. That's a one-on-one consultation, which is a service that we offer. So if you're looking for, hey, what type of plan is available to me and how much does it cost, that's not this presentation. Also, Medicare is an individual sale, so it's plans are underwritten down to the local county. So everyone's offering is different. Price points are different. What they're offered is different. What carriers are available. So that's truly a one-on-one conversation. But we will talk about the basics, right? What the different plans are, what they get you roughly, and just the basics. Continuing with the review, enrollment periods are very important with Medicare. A common phrase you'll hear is make the right decision at the right time, avoid penalties, all sorts of headaches. So the good news about your situation, I reviewed your benefits offering through the diocese, and you all have a really strong benefits package. That's one of the strongest packages I've seen. So one thing that's nice about that, if you're 65, if you're past age 65, you're still working and receiving benefits from the diocese, you don't have to do anything with Medicare. Absolutely, and you have no worries. You only have to do something when you're going to lose that coverage, go on to retire or leave employment there. But let's run through the enrollment periods because they are very, very important to understand. So I break down the enrollment periods between the top, original Medicare, that's Part A and Part B, and then the bottom, which is, Medicare supplement, Advantage plans, Part D plans, and the next page will be supplement plans. But starting with the A and B, original Medicare, everyone's initial enrollment period is the same. It's 3 months before your birthday month of 65, your 65th birthday month, and 3 months thereafter. So it's 7 total months. That's your initial enrollment period. Definitely you want to make the right decision then. If you're continuing to work and receive benefits, probably the right decision is just to do nothing or take Part A because it's free. And we're going to talk about that. We're going to talk about that more in just a couple slides. I'm going to skip general, but I'm going to go to special enrollment because this is extremely important for the population on this call. Special enrollment is likely what most of you will have if you work past age 65. So let's say you're 68 years old, you delayed Medicare originally because you have continued to work and you've received benefits from the diocese. Now you want to retire. Okay, you're going to have what's called a special enrollment. Special enrollment is valid for you all year long when you have a qualifying event. Losing employer group coverage is a qualifying event, so it's valid all year long. Okay, so anything you hear about having to make a decision at this time or that time, it doesn't really apply to you because you have a special enrollment. Now moving down to enrollment periods for the Advantage plans and drug plans, it's going to coincide, number one, the initial coverage election period. That's when you first get enrolled into Medicare. So that's going to coincide really with your initial enrollment period for original Medicare, for Part A and Part B. Now again, if you're working past age 65, you're going to miss out on that enrollment period, and you're going to drop down to special enrollment period again. Again, this is valid all year long, and losing employer group coverage allows you to tap into that special enrollment period, so you can never be blocked out of these Medicare plans, okay? Once you lose coverage, you'll be able to use the special enrollment period and move on to place coverage. Now, the second bullet point down, this annual election period, this is for folks once they're in the Medicare system. Once you've purchased a plan, whatever, this is each year, you have the opportunity to shop your Medicare Advantage and prescription drug plan and see if you want to make a change to better your situation. That's October 15th through December 7th every year, and the effective date for that change would be January 1st. So that's a busy time of year for me because a lot of people want to shop around, see if they could do better. That's the service that we offer our clients. And again, that's for once you're in the Medicare pool. I'm going to skip out on the lower ones. They're not as applicable to you folks right now. The enrollment periods for supplement plans and Medigaps, this is an important note to make here. The enrollment period for your Medicare supplement plans, you have a 6-month Medigap open enrollment period. It's automatically starting the first month you have Part B and are 65 or older. Now, the reason why this is so important is because if you do your full analysis, review, talk to consultants, if you decide that a Medicare supplement is the product for you, once you're in need, you want to make the decision within that 6-month open enrollment period. So within 6 months when you get that Part B and 65 or older. If you didn't make that decision at that right time, what could happen is, let's say 2 years down the road, you decide now I want a Medicare supplement, but originally within my first 6 months I did not tap into one. What could happen is they could use pre-existing conditions against you depending on what state you live in. So the rules change for every state. For example, where I am in New York State, it's a guaranteed issue state, so they can never hold pre-existing conditions against you to raise your premiums or deny you coverage. But some states they could. And talk to me specifically about your situation. I'll tell you if you have those constraints. These are not constraints on the Medicare Advantage plans, only the supplements. So long story short, if you think a supplement plan is for you, whenever you first enroll into that Part B Medicare, make your decision within 6 months of that to guarantee yourself the lowest premium and availability to all the products. All right, how to enroll. So how do you enroll into original Medicare? That's the Part A and Part B, and that's at Social Security. Once again, that's the part controlled by the government, Social Security. You could do it on the phone. Online is really the best. They recently revamped their portal. About 10 minutes if you go online and do it. If you're in a special enrollment, if you've worked past age 65, you're going to have a couple forms to complete. The employer will have a couple forms to complete. So a couple extra steps there, but you could do it in person, on the phone, or online. How do you enroll into the other components, right? Part C, Part D, and supplements. A multitude of ways. You could go through someone like myself, a licensed agent. You can go directly to the company. You can go through Medicare.gov, any assortment. I do believe going through a brokerage service like ours does give you availability to maximize. If you trust the person you're working with and you find someone that's been doing it a long time, I think it is probably one of the best options for you, just because you can fully get analysis on your situation, your prescriptions, have availability to all the plans. Just have to be careful about who you're working with. Avoiding late enrollment penalties is another hot topic for folks as they work and age towards 65. There's 2 penalties to focus on. The first one is the Part B, late enrollment penalty. So in layman's terms, what this penalty is all about is basically saying you have to have Part B Medicare once you're first eligible, or you have to have a credible plan. If you don't, and you go a 12-month period without it, you're going to start to get penalized, okay? And the penalty is pretty pricey. It's 10% for each 12-month period that you could have had Part B but didn't. So this is pretty rare that I see this penalty, because any of you who are eligible for Part B at age 65, if you're continuing to work and get benefits, that's a credible plan. So 100% you're good. This is for people that don't have a credible plan, are eligible for Part B, but still don't take it. So not that applicable to the everyday person here, and you don't have to worry too much about this one as long as you have coverage. Much more common is the second one, the Part D, as in drug, late enrollment penalty. This penalty is saying a similar thing, where you have to have, in this case, credible prescription drug coverage by Medicare standards at all times if you're in any component of Medicare. So what this is saying now is that if you even have just Part A, you're in a part of Medicare. Okay, so even if you just have Part A, you still have to make sure that you have a credible prescription plan. And if you didn't, and you go 63 or more days in a row without that coverage, then you're going to start incurring this penalty. Cost of the penalty is 1%, the national base beneficiary premium. Layman's terms, basically if you go a full year, it's around $3 to $4 per year. And these are lifelong penalties tacked on to monthly plan premiums, by the way. Now, again, everyone on this call is safe because your plan's prescription coverage is credible. Now, currently, it's credible. I don't know what anyone does in the future. You know, if you leave employment, go somewhere else, always check. What you will have is each year you'll get a credibility notice, which will literally tell you, is your prescription plan attached to your employer plan? Is it credible or non-credible? As long as it's credible, if you're in Medicare, you're fine. You don't have any worries. If you ever get a notice that says that it's non-credible, that's when you want to make sure that you buy a Part D plan so that you avoid the penalty. Choices and considerations while employed. Now, I like to narrow it down. This is towards the end of the presentation here. As you come to age 65 and work past age 65, for the folks on this call, you really only have 3 choices. So if you simplify to this, you're 100% squared away. And it's actually even more simple for you because people on this call, the benefits are so robust that, you know, option 3 is really wiped away. But starting with option 1, your first option, you can maintain the employer coverage and delay Medicare Part A and Part B. That's what a lot of you probably will do, right? You're happy with the coverage, you're just not going to do anything with Medicare. Your second option is to maintain employer coverage and enroll into Part A and or Part B. This is another common option that many of you will take because what you could do is simply take Part A. Part A is going to pay hospitalization claims secondary to the employer plan, and it's free. So there's no harm, no foul in doing that, right? It's free, and they'll pay secondary for hospital claims. So option 1 or option 2 are the 2 options that you folks are going to take. Option 3 are for other companies that I'm giving presentations to. It's basically waiving employer coverage and moving to Medicare. That happens sometimes, you know, for folks that don't have a great health plan through their employer. Maybe it's high deductible, maybe it costs them a lot of money out of their paycheck. Moving to Medicare sometimes is wise for them. But for you folks, option 1 or option 2. There's a bunch of considerations as you look at these items. You know, whether you're 65 and continuing to work, or if you're going to be planning retirement soon, there's a bunch of items to look at. And I'm just going to touch on the ones valid for you. Some of these don't even apply to you. But on the top left, you always want to focus on the primary and secondary rule. Remember, it's just as a basic education note, Medicare is always secondary. to employer coverage as long as the employer has more than 20 employees, which your employer obviously does. So Medicare is always secondary. Employer plan is going to be primary for you. Other considerations, keep an eye on that Part B premium. It changes. It just changed this January 1st. It increased for the first time in a few years. But as you're budgeting, planning for these things, keep an eye on that. Look at your income from 2 years ago. A lot of folks get surprised at how much they have to pay for Part B when they go. So it's a good item to start planning. Some of the other ones, provider networks is a big concept in the Medicare world. As you're planning for these things, it's the Advantage plans that have the provider networks. The past few years, we've seen huge increases in nationalized provider networks, which have really improved the offering of Medicare Advantage plan. But never jump into a plan. You really want to check all your doctors, hospitals, providers. Make sure you're comfortable as you make that decision. And again, our service is obviously there to hold your hand with those types of choices. Health savings accounts. This doesn't apply to you folks right now, but it's a very, very big note to make in the Medicare world as you become 65. If you enroll in any part of Medicare, again, even just Part A, make sure that you never contribute to an HSA account because that's out of compliance. You can have a health savings account, spend down the money, you just can no longer contribute. So whatever your future brings, if you have Part A Medicare or any other part, make sure that you are not contributing to an HSA at that point. The penalties we went over. Dependent is another hot topic with Medicare. Just remind yourself, right? A lot of folks come to me looking to retire, and they're the ones that have the employer coverage in their name, and everything's ready to go, and then all of a sudden they find out, oh, my spouse is 2 years younger than me. 63, they're not eligible for Medicare for 2 years. That can really change someone's plans because, non-Medicare individual coverage is very expensive right now. So, keep an eye on who you're covering and include that in your planning process with timing. And those are the ones that I'm going to cover today for you. And, other questions, just feel free to reach out to me. There I am, so you can put a face with a name. I'm usually on video for these things, but I'm not sure the setup you folks have over there. But that's me, and that's my contact information. You'll receive it if you haven't already. I'm going to run through one major resource that we have for you. We have a whole resource library, abundant resources available to you. One resource that I'm going to try to get distributed to you, if it hasn't already, is our branded Medicare guide and checklist. What I did with this is, if you were to go and get the government-sponsored Medicare packets, they're like 150 pages long, and it's really overwhelming. It really is. And what I saw that there was a heavy need for was something that had most of the information simplified down. So what I did is simplify this to a 10-page document. It's really only 8 pages of actual data. What it's going to be interactive. So you're going to be able to plan for Medicare with the checklist. Checklist is right here. It's 1-page checklist. As you become eligible for Medicare, you can go through, check off every item, right? Just for example, right? Begin planning right from the top. Begin planning 3 to 6 months ahead of eligibility. Number 2, understand the parts of Medicare, A, B, C, and D. Number 3, understand Medicare Part B premium costs. It goes down the whole list, right? If you do this worksheet, you can have full peace of mind that you're making the right decision at the right time, and just get really clear direction on if you have to do anything and where to go if you do need to take action. So you have the planning for Medicare with the checklist. You have the education with the understanding Medicare. This is going to run through a lot of what we discussed, A, B, C, and Ds, with expanded language, cost of these things, actual coverage. Part B premium rates table is right there. This is a whole packet that you can keep and reference. The enrollment period section is there. The enrollment penalties are explained again, and a bunch of the considerations are also here as well. So a lot of what we just went over just expanded upon. And then the last page, which is really valuable, is a key contacts, resources, and links page. So number one, for all your servicing needs, questions, even just a quick phone call, from a 5-minute phone call with your questions to a full plan enrollment and analysis. You can come to us, email, or call. My information's right there. All these items on the left are things that we can help you with. We could give you access to a full resource library, do prescription analysis, wellness, incentive support, all these things. At the bottom are a bunch of key links that are applicable to folks, trying to understand these things. Medicare.gov, official government site, right? SSA.gov, that's where you're enrolling, so on and so forth. So you have everything as like an all-in-one guide here, stripped down, just 10 pages, and it's really valuable. So that's just one example of a resource that we can get you. We have a lot more, right? Even if you just need the forms of applying for Medicare, Part B enrollment form. Anything you need in the Medicare world, you can come to us, we'll simplify it for you and kind of give it to you straight so that you're not left guessing. So that concludes my portion of the presentation. I hope that you liked it. Again, feel free to reach out to me with any questions, but I will stick around for questions, whether now or at the end of the whole seminar. So hopefully I'll hear from you, and I'm going to stop sharing now.
Good afternoon, everyone. It is my honor and my pleasure to be in front of you today talking about a subject that is very near and dear to my heart, retirement. My name is Chip Fowler. Sorry, I have a frog in my voice. I'm a certified financial planner, joined today by my son, Brian, also a certified financial planner. Brian's the color analyst today. If you watch an NFL football game, I'm play-by-play. He's color analyst. He'll jump in where he thinks I miss anything. And that does happen from time to time now that I've reached the ripe old age of 62 today. But all wish me a happy birthday. Retirement. The 6-month period leading up to making the decision to retire causes enormous amounts of angst and stress and anxiety in people's lives. When people come into the office and walk through the door to have that meeting, no one is smiling. There's a lot of worry because there's a million unanswered questions. Will I have enough income to pay the bills? Do I have to sell my house and downsize? And if I downsize, am I going to a townhouse, a condominium, an apartment, or am I moving in with one of my kids? What's Medicare? What's Medicare supplement? What's long-term care insurance? What's a reverse mortgage, and does that make sense? So the questions go on and on and on. And when someone comes into the office and they ask the question, can I retire? It's not that they need my blessing to retire. They just want someone to look at their numbers and give them an educated guess. Tell them what we think. On a scale of 1 to 10, with 10 being absolutely, why are you still working? And 1 being, I think you still have a little work to do. So what we do is not brain surgery, right? We take a piece of paper, and anybody in this room can do this. We take a piece of paper and we draw a line right down the middle of the piece of paper. And on the left-hand side, we list everyone's fixed costs on the left-hand side. And on the right-hand side, we list everyone's streams of income. And if I have a pretty good idea of what your debt is and where it is, and what your spending patterns are, because we're all either savers or we're spenders, and people try to convince me over the years they're a little bit of both, but they're usually not. I can make a pretty good guess as to whether you're in good shape to retire. So let's look at each side of that ledger really fast. The left side of the ledger is all of your fixed costs for the month. So if you still have a mortgage, it's principal, interest, taxes, insurance, gas, electric, Comcast. We could just get rid of that Comcast bill. We could all retire. Car payment, that's pretty much it. In your, there's a sheet that looks like this in your folder, and you don't have to pull it out now, but if you forget everything I say today, when you get home, pull this sheet out. It's just a template to create a budget or have an understanding of all of the fixed costs that you have going out. You can't even begin considering retirement until you know, like the back of your hand, everything that goes out each month for fixed costs. Not only while you're working, but once you retire. Because while we're working, I mean, let's face it, we're getting up, we're getting a shower, we're getting to work, we're working 8 hours, we're going home, going to bed, and starting all over the next day. When you're retired, you have all day to spend money. Now that's okay if you're a saver, not so okay if you're a spender. So on the other side of the ledger, you have your streams of income. So it's any pension plans, defined benefit plans, IRAs, Social Security. So again, we want to make sure the streams of income are greater than the fixed costs going out. And if they're not, then we're either working longer or we're cutting our fixed costs down somewhere. Okay? So the real reason I'm here today is to talk about ways to save money between now and when you retire. So the first way is through what is called a 403B tax-deferred investment plan. 403B plans have been around since 1956, long before 401k plans or IRAs. For many years, employees of nonprofit organizations were the only employees in the country who could save money on a pre-tax basis. So there are two benefits to saving in a 403B plan. One is the only way you put money in is through your paycheck. So it's a forced savings plan. For those of us who are spenders in the room, it's a really good way to save money. Someone's taking it out of my paycheck for me, and they're sending it off to my investment vehicle. If I'm not disciplined every month to do that myself. All of the contributions that you make to a 403B plan go in on a pre-tax basis. So all of, every dime you put in reduces your taxable income dollar for dollar. So if I make $20,000 a year and I put $2,000 into my 403B, when I get my W-2 at the end of the year, it says I only made $18,000 for tax purposes. You've carved out a piece of your income and you have sheltered it from Uncle Sam. Now, as that money sits there, it earns interest and dividends and capital gains, and that money, that growth is tax deferred. So forced savings, pre-tax on the money you put in, and all of the dollars that are in there grow tax deferred. So it's like a snowball effect. Over the years, it gets larger and larger, and the logic behind it is you're going to put the money away while you're working full time and you're in a higher marginal tax bracket, and you're going to withdraw it when you're retired and you're no longer receiving income from the Diocese of Camden. So that's the 403B plan. Hopefully everybody here is putting something away in a 403B plan. The maximum you can put in is a lot. It's $27,000 a year. Nobody puts $27,000 a year into a 403B plan. But as you get closer to retirement, it's important. It's important to save as much as you can and make it hurt, because I work with a lot of people who put more into their retirement plans the last few years because they want to reduce their income to a level where it's going to be once you retire. I mean, it's almost getting used to what you're going to live on just a little earlier. Plus, you're saving a lot of money that you can use. So that's 403B. The only reason I put this screen up is really the first two lines there. Once you're 59 and a half years of age, you can withdraw money from a 403B, whether you're working or retired. So if you're older than 59 and a half right now, all the dollars you save in I mean, if you're saving money now anyway, you might as well do it on a pre-tax basis because you can withdraw it anytime you want. If you're retired, you only have to be older than age 55 when you retire. Okay. So it used to be that at age 70 and a half, we were required to withdraw money from our pre-tax retirement plans. It's called the required minimum distribution. That age has now been changed to 72, right? They got rid of the half year, which was very confusing to people. But at the age of 72, it's the IRS saying to us, we're not going to let you grow this money tax deferred forever, right? At some point, the government wants their piece of the pie. I'm going to describe how most people do this. You don't have to do it this way. It's just how most people do it. Most people that I work with take money out of their retirement plans for the required minimum, not because they need the money or want the money, but because the law says you have to, and the penalty for not taking it out is 50%. So most people want one check per year as late into the year as possible. Why? Because they want that money to earn all the interest and dividends and capital gains it's going to earn before they actually pull it out. So like in the month of December, we have a gazillion required minimum distribution checks that go out. You don't have to do it that way. You can take quarterly. Some people take quarterly checks because they want to pay property taxes with it. Some people take monthly checks because they want another stream of income coming in that they can use to pay the bills with. You can do it any way you want to do it. You just want to make sure by December 31st of the year you turn 72 that you take that money out. Okay? Wanted to talk about that. And the next. So the next form of saving for retirement is through what is called a Roth IRA. So a Roth IRA is the polar opposite of a 403B plan. Remember I said in a 403B plan, the money goes in on a before tax basis, pre-tax basis. Money that you put into a Roth IRA goes in on an after tax basis. Like you have to pay tax on the money first and then put it into a Roth IRA. So why would someone do a Roth IRA if it's after tax on the money you put in? And the answer is because it grows tax-free. A traditional IRA, a 403B, they grow tax deferred. A Roth IRA grows tax-free. Important to remember, in order to withdraw money from a Roth IRA and for your growth to be tax-free, you have to be older than 59 and a half, and you had to have started the Roth IRA more than 5 years ago. So if you go in thinking, you know, I'm older than 59 and a half, I can put it in and take it out anytime I want. I'm talking about the growth now. Your contributions, because they went in on an after-tax basis, that money you can withdraw anytime you want. It's actually one of the benefits of a Roth IRA. If you have a real emergency, you can take the money out at any time. So the question I always get, well, if 403B is pre-tax and it grows tax deferred and Roth is after tax but it grows tax-free, which one's better? Well, the real answer is the two are the actuarial equivalent of each other. Now, sometimes someone will raise their hand now and they'll say, well, Susie Orman says putting $2,000 a year into a Roth IRA is better than putting $2,000 a year into a 403B. And she's right, it is, but it's an unfair comparison. You're putting $2,000 into a Roth IRA, that's the equivalent of putting $2,500 into a 403B, because one's on a pre-tax basis and one's on an after-tax basis. What will ultimately determine which is the better way to save money is if we knew sitting here today where marginal tax rates were going to be the day we were going to withdraw this money. And since we don't know that, you're better off putting some in, half in one and half in the other if you can. All right. Roth IRA, there's no required minimum distribution from a Roth IRA. Something people like about Roth IRAs. At age 72, unlike your 403B and your traditional IRA, you're not required to ever withdraw money from a Roth IRA. And it's not payroll deducted. The 403B is payroll deducted. Roth IRA, you're writing a check or setting up an automatic investment plan through your checking account to invest in that. Okay, so if you were hired prior, I guess if I could have a show of hands, if you were hired prior to July 1st, 2009, raise your hand. All right, that's almost everybody here. So you guys are in but you guys are in the defined benefit pension plan. Anyone hired after July 1, 2009, you're in, thank you, you're in the 401A defined contribution plan. And the way that plan works is it's an employer-sponsored plan. You do not put in any of your own money into this plan. Once a year, the diocese contributes 3% of your W-2 income. So I get the question a lot, can I add to that? Is there a match? No, it's strictly employer-sponsored. So you should be receiving quarterly statements from Empower that show you how much went in, what your either growth or loss was, depending on how the stock market and the bond market did. And that should be mailed directly to your home every quarter. Yeah, Brian just made the color commentary that this is all employer money. It's diocese money that goes in there. It's not your money going in there. Yeah. There is a 10-year cliff vesting schedule in the 401A plan. So even though the diocese puts 3% in every year, you don't really own that money until you're here 10 years from the day you were hired. And it's a 10-year cliff vesting schedule. So it's 0% up to 10 years, and then it goes to 100%. Okay. I think 80% of everyone who signed up in the 401A plan is in what is called a target retirement portfolio. And in a target retirement portfolio, for people who don't micromanage their retirement plans, when you invest in a target retirement portfolio, you're supposed to be investing your money in the target portfolio closest to when you'll reach age 65. Right, so I'm 62 today, so for me, I would be investing in the target 2025 fund. Because you're telling the company how many years you have to go until you are, in theory, going to retire. So they know, based on your time horizon, how to invest these assets. They usually pick 9 or 10 different funds that are appropriate for someone who has that kind of time horizon. They automatically rebalance the portfolio as you get closer to retirement. So if you're not looking at your statement, if you're not picking your own funds, if you're not making changes from time to time, then you want to be in a target retirement portfolio. Social Security. I'm going to give you my 2-minute theory on Social Security and when to take it. I just put up, let's assume for a minute someone's retired and they're 62 years of age. And if they start their Social Security at age 62, they're going to get $20,000 a year. But if you wait 1 year and don't take it, your Social Security will go up 8% every year you wait. But every year you wait, you just gave up an entire year of Social Security income. So if this person decides to wait, they're going to get $1,600 a year every year for the rest of their life. Good thing, right? But they just gave up $20,000 to get that additional $1,600. So now the question is, how long do you have to live at $1,600 more every year to get $20,000 back. Well, present value, adjusted for inflation, all that stuff, anywhere from 12 to 14 years is how long you have to live. Now, if everybody in your family lives to be 99 years of age, then that's an argument to wait, right? Most of the folks I work with, like, they don't have the luxury of waiting. When they're retired and they're at least 62 years of age, they're taking Social Security because they need it to live on. The other thing with Social Security you have to think about, and obviously I'm a big believer in taking it as soon as you can. And if 62 is it, take it at 62. By the year 2040, there will be 8 people on Social Security for every 2.8 people working. Well, think about that. It's called the silver tsunami, and it is coming. And no one's talking about it. There's not a politician out there who's willing to, like, take that one up. But how is that going to work? Like, how is Social Security going to stay in its current form under that kind of pressure? Well, it isn't. In time, the taxes we pay will go up, the benefits we receive will go down. My point is, if Social Security is in front of you and you can take it in its current form, I would not wait 1 second. I would absolutely take it. By the way, any time a client of mine has ever asked anybody from Social Security when they should take it, they all say 62. So that's my 2 cents on Social Security. By the way, obviously you have no way of knowing when the perfect age. Like, we have these software programs that are, expensive software programs. We put in all this data. It's supposed to tell someone the perfect age to take Social Security. Well, every software program assumes that you're going to live to either age 90 or you're going to live to age 100 when they make their assumptions. And I don't know. I just think that's unreal. I mean, I hope we all live that long. But I just think they're unrealistic. So take it as soon as you can. I think that's it. So beneficiaries. There's a second thing you want to remember, not just doing your fixed costs when you get home. I meet with more people who have not even looked at who their beneficiaries were on retirement plans for years and years and years. It could be an ex-spouse. We check beneficiaries all the time, and it could be your parents, but you're married now. It could be. My only point when I'm putting beneficiaries up there, line up all of your retirement portfolios and absolutely check who the beneficiaries are, because a lot of people are really surprised at and God forbid something happens and you're leaving this money to someone you never intended to leave it to. And lastly, there's an organizer in your packet. This was actually given to me by a client of mine, and this has nothing to do with retirement. This is more like end of life stuff, but it's a great organizer where you can write down, and I'm sure many of you have done this already, but you can write down, list all of your insurance policies, all of your credit cards, like who your accountant is, who your financial advisor is, who your attorney, like there's a million things you can list there that just going to make it really a lot easier for your family when the time comes. So I think that's important. If you fill that out, just please keep it in a really safe place. The last thing you want is for that information getting out. So 9 out of 10 people tell me retirement was the greatest decision they ever made. 1 out of 10, they're miserable. And I found that they're miserable because they're not working, they're not exercising, they're not volunteering, they're not really doing anything. Maybe they were miserable before they retired, but that's a whole other thing. So just have a plan. You have to have a plan. You have to fill your day. and have a will. Anybody here who doesn't have a will, please get a will. It's unbelievable what a low percentage of people who actually have wills. It's something that's critically important. That was from Brian also. Well, that's it. Thank you, everyone. And we'll be around for questions afterwards. I don't know if we'll have time, but.
Okay, I'm here to talk a little more about Social Security. I said to Chip over here, I waited to collect my Social Security because I kept thinking that I didn't need it yet because I'm still working. Is that good, better? Okay. And that is a factor if you're still working. There may be other things involved. If you work and you're still working at age 60, your Social Security, you are limited as to how much you can earn without your Social Security benefits being reduced. And the amount you can earn without anything being any way hurting your Social Security is about $20,000 if you're trying to collect before your normal retirement age. After your normal retirement age, you can earn $1 million and you're not going to get hurt. You'll get the full amount of your Social Security benefit. Okay, next, Dina. Okay, just a few things. When I say retirement benefits, I'm talking about the Social Security retirement benefits. And in order to get them, you need to pay into Social Security for 40 quarters or 10 years. So if you've worked any time in your life and paid into Social Security, you will be eligible to receive the retirement benefits under Social Security. And if you were born on or after 1962, your normal retirement age is 67. Prior to that, it's 66, and it goes way back when it was only 65. I think we all think retirement is 65. It's no longer 65, it's 67. And that means at age 66 or 67, you're able to get your full retirement benefits through Social Security. So if you're, let's say, my age, if I retired at age 65, I wouldn't get full Social Security. It would be reduced by the 2 years before whatever that I collected. And for each month you wait to start your Social Security benefit, the benefit does go up. So that's what was in my head until I listened to Chuck. And now, Chip, and now I'm thinking, why did I do that? But that's all right. It's water under the bridge. So yeah, you can wait until you're 67 and then start collecting, and it will be higher than it would be at 62. Once you've qualified for Social Security benefits, once you've worked for 10 years or 40 quarters, you not only qualify down the road for retirement benefits, because let's say you're only 40, but you've qualified because you've worked 10 years, you would qualify for disability benefits if you need it prior to age 65. And your survivor benefits, you also qualify for. So it's important when people say, you know, I'm used to working under the table where they're not taking Social Security. It may hurt you or your loved ones at some time in your life. And I know about 20 years ago or so, my husband went out on disability and he was able to collect, now he's over 65, but he was able to collect Social Security for all those years. And it was a big help considering that he couldn't work any longer. If you died, God forbid, and you weren't 65, your spouse and children would get a benefit. And actually, when he went out on disability, my 2 children got Social Security benefits until they were age 18. So it was a help. Okay. Social Security benefits, as Chip alluded to, is not today intended to fund your whole retirement. Years ago when it was invented, that's all people had to live on. Now that we have pensions and investments and so forth, you're going to need other streams of income to be able to retire. So don't think of Social Security as your only form of income, because it really won't cover your bills, even if you're a saver. The benefit amount that you get is based on your 35 top years of income. So that's another thought as to if you're working past a certain age, if you're making a lot of money during those ages, it may actually increase your benefit because it would be the 35 years. So my days of working as a cashier in the grocery store might be bumped off if I kept working and was making a higher salary. So that's something to consider. When you're receiving Social Security, you do get a cost of living increase most years, and that helps as well, and you're notified each year of what it will be. And the age that you do claim benefits will affect your surviving spouse's benefits. So if you collect early, the benefits will be less. If you collect on time, the benefits will be more. Now, what about those spouses? If you were married for 10 years and then you get divorced, even though you're not with that person anymore, you can tap into, if you don't have your own 10 years, you can tap into the ex-spouse's 10 years of Social Security credits. Now, luckily, that doesn't keep your existing spouse from collecting, or you. So if you've been, I was just sitting here thinking about what about the people that have been married 5 or 6 times? They're going to be really, right, sucking the Social Security system dry, because they'll all be tapping into Social Security. Okay, so you'll still get the same amount even if you do have 6 spouses and they're all collecting on your 10 years. Now, we'll be looking at questions and so forth. I didn't go into a lot of Social Security information, but I will say you can apply for it online or at your local Social Security office. There are 3 items in your packet on Social Security. One of them is how to apply online. Just know that one of the things that you heard from Steve was that your entry into Medicare comes from applying for Social Security. So your first step along the way should be Social Security, and while you're there, they'll be signing you up for Medicare. But what if you retire, you're lucky enough to want to retire early, and you're not 65 yet, and you don't have Medicare? What do you have through the diocese that can help you, and what's on the outside? So as a diocese, we do not have COBRA. We're exempt from offering COBRA. If you've worked at any of the other dioceses around, they don't have COBRA either, so it's not just Camden Diocese. And but we do offer through the Camden Diocese a continuation program where you can sign up for 6 months of continuation coverage, but you'll be paying the full amount. And I think if anyone's ever going to have a heart attack, it's when Candy tells them what the rate really is for your health insurance. Does anybody have any idea what percentage employees pay of the health insurance? Anyone want to guess? It's actually 11%. So 89% is picked up by the diocese. So think about that amount that comes out of your check that seems so high, and know that that's only 11% of the rate that's being paid. So that's the rate that you would pay. I would suggest that before you just accept that as what you want to do, that you go out to the healthcare.gov website, the ACA, what we used to call Obamacare website, and you can find coverage through that, and you may qualify once you're retired for subsidy. You won't qualify for a subsidy if you ever go out to the market and you're still employed. But once you are retired, you can go out to the market, and if you're under 65, there's lots of subsidy available to you because your income drops. The other thing I just want to mention is that healthcare costs this past year went out of sight for the diocese and for everyone. I handle the health insurance for all the dioceses in New Jersey, and every one of them got killed this year in cost. And and every other client I have that's not a diocese got killed. What they think happened was during COVID, everyone stayed home. Didn't go to the doctor. If you remember, once in a while you could get there if it was an emergency, and they didn't really want you in the emergency room. And many people apparently were sitting at home and their conditions were getting worse. So what we're finding is now that COVID has abated a bit and people are getting out to the doctor, they're finding that they're sicker than they realized, or things are being discovered at a much later stage. And it's very sad to see, but it's resulted in a lot of claims. So this year alone, the diocese they knew it all along, but just got hit with the fact that your claims went up over 30% this year alone. And I'm telling you that just as a precluding, message that your deductions are going to go up. We're doing everything we can to keep them as low as possible. But I thought since you're in the meeting, you want to hear why, when you see things did go up, why they went up. And I know Dina's been working every single day. We're trying to find out what we can do, still keeping the benefits, because Chip's right. These benefits that you have, or no, it wasn't Chip, it was Steve at the beginning. He looked at the benefits and he said, why would anyone want to go on Medicare? These are the best benefits in the world. Well, one of the things is if you retire, they're too expensive. So you're going to be looking. And if you retire, I will tell you the Medicare plans that Steve is talking about are the best in the world. That's the one thing I always say that is positive about turning 65. The only thing that I've experienced since turning 65 is Medicare. It's wonderful. The plans are wonderful. The rates are wonderful. Everything's wonderful. As long as you put money away for your bills. And I did want to mention before we start for questions, because Steve didn't mention it. Steve works with me at Gallagher. He's our Medicare specialist. He can help you select plans and help you enroll, and there is no cost for any of Steve's services. I kind of wish he had said that up front, but anyone that calls him, there is no charge. He gets actually paid not only through Gallagher, but through the government as a registered, licensed seller of Medicare benefits. So don't hesitate to give him a call. He loves calls, and he'll be happy to answer questions here. So that's all I have.
Okay, we're going to use every minute of our time. We have about 10 minutes and only a handful of questions, unless there are more. Would Kathy and either Brian or Chip sit at our panelist chairs, please? Okay. So this is a question on Social Security and pension. So I think, Chip, this probably would be you. Are taxes charged on Social Security and or pension? Is it taxed? Is pension and Social Security taxed?
So pension income is taxed 100%. This is money that you've never paid any tax on before, so it's definitely taxable. Federal tax depends on what your overall income is in New Jersey, whether you pay state tax or not. You won't, if you live in Pennsylvania, you won't pay state tax. By the way, I am not an accountant, so. And then on Social Security, I think if you file jointly and your combined income is hot between $32,000 and $44,000, you pay tax on 50% of your Social Security income. All right. Yeah. See, I thought if you made more than 44,000, you only paid tax on 85% of your Social Security income. Yeah. Yeah.
Okay, this one I know the answer to, but Kathy, it's for you. Do we have an HSA plan? And the answer is no.
The good news for you guys is once, if you're thinking of retiring, when you turn 65, an HSA plan will not help you because you can't contribute to it. But no, in order to have a HSA plan, it has to have a high deductible on the front, and the high deductible starts at $1,500. But I will tell you, no employer has less than $2,000 in deductible, and that means every single piece of the plan is not going to pay. You're not going to get payment on until the deductible is met. So if you go in to get a prescription and you haven't met your $2,000 deductible, you'll get nothing. So.
Another question for probably Kathy. Can you take Social Security while you are still working? Well, we answered that question, right? Yes, you can. You're limited to the 20,000 until you reach, if you take it prior to reaching full retirement age. And that could be anywhere from 65 to 67, depending on your age. And if you do, will you get the full amount each month? Well, yes. Yeah. Okay. And then Steve, are you on? There is a question about the donut hole. Please explain the Part D donut hole.
Okay, if Steve comes on, I'll let him do it. I'll have to wing it. On Medicare Part D prescription plans, and those are the ones that you'd get if you retired. When you reach a certain amount of money, and that's where I don't remember exactly how much, but once you've paid out a certain amount of money, you come out of the normal payment schedule of copays and into what they call the donut hole. And during the donut hole, generic drugs are not covered, but brand drugs are covered. And the brand drugs are covered at a certain percentage. This was something that was done when President Obama first put it in. And he did, I think President Bush introduced Part D. President Obama was trying to close that donut hole. And all it is you pay for the cost of your drugs during that hole, and the drug companies subsidize it. So it's getting closed. Another, I think, 2 years and the donut hole will be closed. But I wouldn't worry about the donut hole anymore. It's just not that big. When you go to sign up, if you sign up, that's where a Steve comes in so handy. There's a million different prescription programs out there. What's really cool is he can put your the drugs you're taking into a system, and that will kick out the best prescription programs in your area. Whether you want to pay a little more in premium but have a deductible, or have no deductible but pay higher premium. The amount of time it would take you to analyze all those would be forever. So make good use of the prescription for Steve for things like that.
Now I'm going to put Pat Josephs on the spot, because when we asked for a show of hands of everyone who was hired prior to 2009, there were a lot of hands that went up. So Pat, if you would just explain to everybody, like if they were interested in tapping into the defined benefit plan, what they need to do. They need to contact you, and you give them 3 months before, if you want that first pension check to occur the first month that you are not working. Contact Pat 3 months before. There's a form to fill out. There are some decisions that you will make that you have sort of have control over, whether you want your pension to be at the highest payment possible to you, which would mean that it's a life annuity, so it's only for the time that you are alive as the participant, or you can make other elections, which would include an additional payment to your spouse or a guaranteed payment for at least 10 years, regardless of whether you're alive. So there's some decisions that are made, and it's all spelled out for you through the actuaries. And then it's administered through PNC, right? I had a brain freeze. Okay, through PNC, and you're sort of on autopilot. You could get it a live check, but most people get direct deposit, and it goes right into your bank account of choice. And again, we need to be notified of change of address. Sometimes you may want taxes taken out, and that amount stays, the amount of your pension stays frozen for once you've made that decision. It doesn't go up, it doesn't go down. But we do have people calling in and saying, all of a sudden, I'm not getting enough taxes taken out, so I want to get a W4P form for pension, and then you can change your withholdings so that it's coming out of your pension check prior to receiving it. Anything else? No? I knew I'd get her to stand up. Let's give Pat a round of applause.
Nobody mentioned this, but I just want to let you know, once you're 62, you can work part-time and still get a Social Security check. They take $1 for every $2 that you make. So in my case, I got my Social Security when I was 62. So age 62, 63, 64, and 65, I got 6 months of Social Security checks, and then 6 months they withhold your Social Security check. Please don't try to figure out what I mean based on that, okay? But then when I turned 66, the 6 months each year that I didn't get a Social Security check, they went back and gave me a lump sum, because then they figured out that I really retired when I was 64, because I had 2 years that I didn't get any Social Security. So my Social Security went way up. Now, I'm telling you, when I turned 66, I went to Social Security and I said, well, when am I going to get the extra money? And they looked at me like I had 12 heads and I was a slobbering old lady. And they said, you don't get that. And I said, yeah, it's on your website. I do get it. And they insisted that I did not. And the month before I turned 67, I got all this back money and my Social Security went up. And also, if you keep working, like I'm beyond the 66, because I'm still working, my Social Security goes up every year. It's not much, but it does go up every year. And just to let you know, you may get a raise in your Social Security, but normally when you get that raise, they will raise your Medicare. So you might get $3. It's not much. So just to let you know. Oh, and if anybody, no. If anybody is in the older plan and you want an estimate of your Social Security, just send me an email, because the latest pension record that you have does not have 2021 or 2022's earnings in it yet. So I can put them in and give you like what you really get. So it's at Patricia Joseph's patricia.josephs@camdendiabetes.org, or it's 583-2869. And I can do it for you within a couple of days. Okay?
And that's Joseph's with an A, Josa. Okay, any questions? Any additional questions? We'll make sure we clear up the donut hole question with Steve's input. Unfortunately, because we were muting him, I don't think he was able to we were able to hear him, but we'll definitely get that. Yeah, but I'm sure it's for everybody's benefit to hear the answer as well. Okay, if there's no other questions, then thank you very much. We hope you found this helpful and informative. And don't hesitate to reach out to any of the resources that you have here at your disposal. And thank you again. Safe home.